Joining us now here in studio is Dr. Lokesh Shahani, a psychiatrist with UTHealth Houston. Dr. Shahani, thank you so much for being here with us. This is such an important topic to tackle. Can you explain to us what is clinical depression?
So when people say clinical depression, most psychiatrists, including me, would interpret it as an episode of depression that has lasted for 2 or more weeks. In medical or scientific terms, we call it a major depressive disorder. Some of the symptoms of major depressive disorder that we see are obviously depression, which means feeling sad, anhedonia, which means you've not been interested in things that you previously enjoyed doing, and there are a lot more other symptoms that associate with them. So they are, either sleeping too much or sleeping too little, eating too much or eating too little, feeling really tired, not able to focus at work, feeling hopeless, and at times having wishes that you were dead or having suicidal thoughts.
What are the causes and the triggers of clinical depression?
So depression is a complex disease. When I explain people depression, I say there are 3 big causes of depression. One is biological cause. When I say biological cause, I mean there's a neurochemical imbalance in your brain that's leading you to have some sort of depression. Then there are psychological causes. Psychological causes could be, dealing with some grief, dealing with some trauma, dealing with an interpersonal conflict that's causing you to have depression. And then there are social factors. We all have stress in our social environment, be it at work, be it in the family, be it a financial stress that kind of adds up. So for depression to happen, you have to have, 1, 2, or 3 of them to kind of start accumulating and then start having depression.
Yeah, you did a great job of laying out the complexity. How do you know which is which type of depression that you're suffering from? If it's something that's triggering in your environment or if it's something that's actually going on inside of your body?
That's a great question, and sometimes we can't. Sometimes it's a combination of two or more of these. You probably have underlying biological issue happening, which leads you to accumulate more social stressors, which leads you to have depression. So it's probably a complex issue, but seeing a psychologist, seeing a counselor where you can actually talk about your problems, discuss your problems briefly is a good start in how you can tackle depression.
Yeah, it's so prevalent in our society right now, and this leads me to my next question. What are some of the treatment options and resources for mental health here in the Houston community?
So when it comes to mental health treatment, just in general, we recommend a dual kind of an option. We recommend patients that, if your doctor is recommending that, maybe medications would be a good start. Along with medications, seeing a counselor or therapist for some sort of counseling or psychological help is definitely going to be a good start. Those, I think, would be good starts for people. Resources when it comes to our community, or our community is urban, so resources are a little difficult to get, but obviously starting with your primary doctor, if possible accessing a psychologist, accessing a psychiatrist to get to that resource is helpful. And starting early is something that's always great, because when you start early, your symptoms are mild, can be treated much more easily, you have a better quality of life.
And the key is to get that help.
Definitely.
Doctor, yes.
Don't be shy, don't be stigmatized.
Right.
Mental health is just one more, physical problem that we deal with, so accessing help is really helpful.
Yeah. And if you see a loved one who you think may be suffering in silence, it's also important to reach out to them and accompany them on that journey to get help.
Definitely, you said it right.
Dr. Lokesh Shahani, appreciate it, psychiatrist with UTHealth Houston. Thank you so much for being here with us this morning.
Thank you so much, Jogan.
And be sure to check click2houston.com/scene@7 for more.